right. So we've talked about the ovarian cycle already. Now we're going to talk about the menstrual or uterine cycle. So those are synonymous names. So the menstrual or uterine cycle is going to run concurrently with the ovarian cycle. So both of these are happening simultaneously. But again, the ovarian cycle is what is taking place specifically within the ovaries to the oocytes and the follicles, whereas the menstrual or uterine cycle is what's happening inside of the uterus itself. So the menstrual or uterine cycle is broken up into 3 phases. 2 of them are listed on this slide. The third is on the next slide. So the first 2 phases are the menstruation or period, is what it's commonly referred to as. This is where the uterus is shedding that built up layer of the endometrium. And this is due to low hormone levels as that corpus albicans degrades and is not making hormones anymore. So we do need higher hormone levels to support maintenance of that endometrium. So without those, it is going to break down and be shed. This happens simultaneously to the early follicular phase in the ovarian cycle. So we're shedding this endometrium at about the same point in time that we are starting to build a new follicle in the ovary. The next phase is the proliferative phase, and this is where the uterus starts regrowing that endometrium, that layer of the endometrium, due to increasing estrogen levels as those follicles are growing in size in the ovaries. And so this is the kind of middle to later stage of the ovarian cycle that the proliferative phase in the uterus is taking place. Ovulation is the marker of the end of that proliferative phase in the uterus and the start of the secretory phase. So this is where the uterus and that endometrium is preparing for a fertilized egg to implant. So there are special glands in the endometrium that are going to secrete different substances that will support early pregnancies, and this will correspond to that luteal phase in the ovarian cycle. So ovulation has happened. We have that corpus luteum producing progesterone still, which helps maintain that endometrial lining, in addition to these other secretions to help support early pregnancies. So again, if no pregnancy happens, the corpus luteum becomes the corpus albicans, which does not produce hormones. This will further break down, and the lack of hormones will trigger that endometrium to shed and mark the beginning of a new cycle. So this graphic, again from the textbook, shows both of these cycles kind of happening simultaneously, which is kind of nice. So you can see how these are working together. So here's that follicular phase, so roughly days 1 through 7, assuming a 28-day cycle length. Again, that can vary a bit from about 21 to 32 days, and that is totally normal. Again, much outside of 21 and 32-day long cycles, that can sometimes indicate that there is some hormonal issues or anatomical issues or something like that, maybe infections. So here's that follicular phase again. So we are developing from primordial follicles into primary and then secondary follicles, and then we've got that single tertiary follicle. And so that is happening here at the same time as the menses and proliferative phases in the uterus. So those are happening simultaneously. Again, assuming a 28-day cycle, ovulation will happen on about day 14. Approximately. There is some variation in that also. And so here in this graph, this is representing the endometrial lining. And so menstruation, we shed a lot of that lining and then start rebuilding it in the proliferative phase. So in that secretory phase, you can see it is at its thickest during that secretory phase in the uterus and corresponding with that luteal phase, because we have those higher hormone levels that are helping to maintain that. And then if pregnancy does not happen, that corpus luteum breaks down into the corpus albicans, hormone levels decrease, and will trigger the shedding of this lining. Further down here, you can see the different hormones. So here in this upper graph in purple, we have follicle stimulating hormone and luteinizing hormone. So these stay at relatively consistent levels, as you can see, throughout most of the cycle. And they really just kind of have those peaks that happen right around ovulation, especially luteinizing hormone. That is what's going to signal ovulation to occur. So that really big increase in luteinizing hormone happens right before ovulation. So we'll increase that hormone level, which signals to the ovaries to actually release that egg from that tertiary follicle. And then down here in blue are our estrogen and progesterone. And so we can see in this lighter blue, estrogen levels will steadily increase through these early stages from the menses up to about ovulation. So that will bump up a little bit right before ovulation and then slowly decrease with a slight increase during that secretory phase that will help maintain that uterine lining. Progesterone stays pretty low until after ovulation. Again, that corpus luteum is going to produce a fair amount of that progesterone. The ovaries will pick that up if pregnancy occurs to help maintain those higher progesterone levels, because that's really important for maintaining a pregnancy. But if pregnancy does not happen, then those progesterone levels will decrease and start that whole cycle over again. So there's a lot going on here in the uterus and ovaries of this reproductive system. That's quite a bit different than what we see with just the testes for the testosterone and sperm cell development. All right, kind of wrapping up the female reproductive system with breast tissue. So this is another important structure that we see. And this is another accessory organ. So this will provide milk through lactation to nourish a baby. There are certain things that can make it difficult, if not impossible, for an individual to produce milk. That doesn't necessarily mean anything is wrong with them. There's just differing anatomies, hormone levels. There's a lot of things that can kind of go wrong. So these are also referred to as the mammary glands. We do have them arranged in alveoli, similar to what we see in the lungs, that are going to make milk. These will secrete those milk into what are called lactiferous ducts, which will then empty into lactiferous sinuses that lead into the nipples, which is where the baby would actually be sucking to get that milk. And so you'll notice lactation, or some variation of that word, exists a lot here. There is a hormone called prolactin, which triggers the development of these glands and making milk if pregnancy happens. This won't start until later on in pregnancy, so it's not really going to gear up a lot early on in pregnancy because it's just not necessary earlier on. But as pregnancy progresses, that prolactin level will increase and start causing that milk to be produced. So issues with prolactin levels can be one reason that some people struggle to breastfeed. Sometimes there's root causes of that, sometimes it's just genetics, but there are a lot of other reasons for that. But we do have really good formulas on the market now to replace breast milk, and ultimately a fed baby is the best case scenario. However, that needs to happen. So here's that breast tissue. So we have these alveoli, those sacs where the milk is starting to be produced. We have our tube system here, so the lactiferous ducts, and kind of transitioning out towards the nipple where the milk will get released ultimately. And we will wrap up this video here and continue in our final video looking at development of the reproductive systems, which is super, super cool, I think. I'm very excited about this video.